All right, so we're going to move on to our next speaker, Kelly Bugos, who is one of the first people I met when I came to Stanford about 10 years ago. So it's really lovely to have her here as part of this meeting today. So Kelly is the Director for Professional Development and the APP Fellowship at Stanford Healthcare. She's a nurse practitioner with clinical practice in cancer survivorship care. Kelly founded the Cancer Survivorship Clinics at Stanford in 2012 and continues to focus her clinical work on helping people touched by cancer restore their health after treatment. So today she's going to be talking with her perspectives on managing the many transitions that happen across the cancer care journey. So thank you again for joining us, Kelly.
Good afternoon, everyone. I'm traveling with my bag of tricks up here just because I'm finishing up a cold and just in case I have a cough or a sneeze. So I just want to first recognize the wisdom in the room here today. I've been listening to this conference all day virtually, and I'm absolutely amazed. And the person that said normal is just a setting on the dryer, could you raise your hand? That was amazing. And speaking of amazing, today is amazing. And I just want to give a shout out to Heather, who brings us together to help us connect and to learn and to grow. And every year she comes up with these meaningful topics. And I'm guessing that many of you have come more than 1 year in a row. So can we give it up for Heather? Absolutely amazing. So as Heather said, my name is Kelly Bugos, and I'm here as a nurse practitioner. I've had the honor of working with people touched by cancer for 35 years. A lot of what I know has been shared from the people who have shared their wisdom with me. And if anyone has ever been asked by Heather to do something, you know that she gives assignment with confidence. So when she said, please address care transitions in 20 minutes, I thought, I'm up for the challenge. But I'm going to ask you for your help. I'm going to ask if we can do this together somewhat, given that we're a large group and we have a virtual audience. So, would it be okay if I asked you a couple of questions along the way? Yeah? Good with that? Okay. So, the first question is true or false. Okay, so here's how it goes. You raise 2 hands if you believe the statement is true. You raise 1 hand if you think the statement is false. Okay, you ready? Do you want to practice? 2 is true, 1 is false. All right, here's the statement. When treatment ends, there is a typical sense of relief. Phew, I made it. True or false? I'm seeing a lot of truths and 1 false, 2 falses, and some like I'm not totally sure. I'm in the middle. Okay, so that speaks to the variety of our perspectives, right, based on our own personal experiences. If you believe the psychological researchers, they'd say that's a common emotion or feeling that people have. The relief can also be coupled with or separate from a feeling of worry. The treatment's over. What's taking care of my cancer? Who's going to take care of me? How will I feel? What's next? All of this can be dependent on the type of treatment and the timing in which people have had that treatment. Some people, as I've heard today, feel worse when the treatment is over, hopefully for just a short period of time. Okay, question 2, are you ready? True or false? True is 2 hands, false is 1. So by your show of hands, do you think this statement's true or false? Once treatment is over, the healing continues. True or false? Once treatment is over, the healing continues. Okay, so I'm seeing mainly true. Some other people hear it differently. They hear, once the treatment is over, the cancer experience continues. So with that, and I've heard a lot of that today when I was listening, so with that often comes the question, oh, that's the last bird you're supposed to see. Okay, moving on. Comes the question of what happens when treatment's over, whether it's over for good or over for a while, what happens? So there's the cancer surveillance appointments, but start to get spread out, maybe 2 or 3 months out. There's not that regular check-in with the treatment team. With you got a question on your mind, just ask it right away. Sometimes there's a plan for what to expect in the future, and sometimes there's not, or it's not known to the person. There may be some confusion. And most of the time, if you take the appointments away, what people say they really want is they want some normalcy. They want to do at least something that reminds them of life before that word came in, the challenge of cancer came into their life. Okay, here's the third question. This is a yes/no, okay? Yes is 2 hands, no is 1. Do you want to practice? Yes is 2, no is 1. Do you know who the captain of your medical care team is? If the answer is yes, it's 2 hands. If the answer is no, it's 1 hand. Okay, so let's go back to the yeses. If you have your yes up, okay, so yeses, I'm going to ask you if you put your hands up. Okay, now leave your hands up if the captain of the team is you. Okay, so look around the room. It's a number of people, right? Number of people virtually, I'm not sure how many people have their hands up, but hopefully you're doing your afternoon exercises. Okay, so if the captain of the team is you, what do you need to lead that team well? Do you need more knowledge, like coming here today? Do you need skills for advocacy, which we've heard about? Do you need to know how to ask those questions, how to get that information to the medical people so that that 10-minute appointment, 15-minute appointment works really well for you? And who should be on your team? So if we think about what the needs are after treatment, it's not the chemotherapy, it's not the surgery or a radiation treatment. It's often who's helping with the afterwards, who's helping with the side effects, the issues that happen as a result of cancer and the treatment. So who needs to be on the team? And that's where this comes in. And I've heard such beautiful, beautiful phrases today of talking about self-advocacy and what that means. And the reason I picked this picture is because I'm going to focus on one part of that, which is the questions of what to ask. And some of the approaches with the self-advocacy that we'll discuss today and some of the things I'm about to say is there methods to even know whether you're the captain of the team or whether somebody else is, there are methods to be able to make your healthcare providers your partners in your care. So here's some questions. These are definitely not exhaustive. It's maybe a way to get us started. And again, these are questions I've gathered from working with people like you over many years. So questions that are fine to ask, are good to ask. Who oversees my medical care? What should I expect in the coming year? What is my follow-up schedule? Who supports the appointments for specialist care for the complications I may be experiencing? And what resources do I have to verify or help me with insurance? How do providers on my healthcare team communicate with each other? And how do I get a summary of my treatment? So I'm going to pause for a moment and see if anyone has, 1 or 2 people want to add a question to this list. Any big burning question that I've missed at the first week? So when I talk to people, it comes down to this. If you're going to ask one question, it's this one. Who do I contact for what and when? Someone says, great, treatment's over, congratulations, see you in 3 months. If there's one question you want to ask, it's this one. Who do I contact for what and when? And here's why I say this. This is a model, so this is taking, what you see here is the framework that we as healthcare providers think about after treatment. And this is in the model of survivorship. So first, survivorship starts on the day of diagnosis. Every one of you in this room is a cancer survivor. And that acute period goes until treatment's over. Then we as healthcare providers are thinking, okay, we know we need to watch for the cancer, but we've done our job. And then the second period starts, which is extended period. This is from the end of treatment where we just said, we agree that the healing continues, the experience continues. You've talked a lot about that today. And then at some point, years later, some point down the road, that starts to shift again. And it becomes what we call the permanent phase. And this is the point in which Dr. So-and-so saved my life to Dr. what's his name? And so where it starts to shift, where that cancer experience no longer holds a primary place in the person's life and their common thought. So let's go back to that day of diagnosis and thinking about what urgency there was at that time of hearing those words and how it changed perhaps your priorities and the way you thought about things, and having to get that right team to be your team, and how to get those treatments, decide on the treatment and how to get those appointments. It's pretty natural to make that the priority. It's pretty natural to forget about blood pressure monitoring, keeping the glucose in control, other cancer screening tests, right? The priority is to address this problem. And then time goes on and that treatment is over, and it's pretty natural at the end of the treatment phase to be thinking, well, I put my life in the hands of these people, and I'm looking at things from the perspective that healing's still happening. So yes, I'm going to ask them my healthcare questions. And I want to show you that is fine, but I also want to show you that sometimes there's some confusion about who to call for what and when. And often I see it happen about this time. Treatment's over, life is starting to go on, and then there may be things said like, make sure you see your primary care provider. Make sure you're doing these things. And so partly what happens from the medical staffs, they're thinking, I don't know how to handle these other issues very well. They may not say that. They're not the experts of those things. And so really the perfect partnership and getting those questions asked and getting the answers is about who is the expert for those issues and how do I get to them? So a word about that healing. That it takes patience, takes time. It takes me flipping to the right page. Okay. So we're saying when treatment ends, the healing continues, and the healing takes patience. So one might look well or not. Others may see a person as well when the person doesn't feel well at all. And a person may not look well, but the person feels great. And this can be true for the person who received the cancer treatment and the person who acted as a caregiver. And so a question you can consider having an answer to is, how can you express your state of healing? How can a person express their state of healing so that they're giving out the message that they want others to hear? Because people will tell me that they may be given back their life responsibilities and they don't feel ready for them. Or perhaps they have limited energy, they're not feeling like they're thinking at the highest level they were, or their self-image is adjusting. They're not ready to trust their body again or their functional limitations. So how can a person express their state of healing? Because uncertainty is something we all encounter every day. It is the most common issue that people experience during the cancer journey. It peaks at 2 times. It peaks at diagnosis, and it peaks when treatment is over. And these concerns can be countered with how a person chooses to think about things, what they put in their mouth, how they move their body, how they respond to uncertain situations, and what they do next. So this could include asking clarifying questions when there's a change in care. As we control how we think about ourselves, I'm not what I was, but I'm happy with what I am. I'm still me, and I love me. This is one way we can take care of ourselves, is by loving ourselves. Additional ways that we can take care of ourselves is by going back to our primary care focus, right? Of thinking about our whole health. And one of the ways to do that is to remember to get those tests done, see those people on your team that can help be sure that there's not other cancers coming up, that perhaps health issues that were existing before that challenge, the cancer challenge came into life, are intact, that they are being handled, that they are stable or gone away. That's one of the things that we can control. And additionally is everything that we can control in terms of our own healthy habits, how we move our bodies, how we decide to fuel ourselves with our food, how we decide to recognize and to manage our stress, and being careful about the substances that we use. So in summary, there's 3 takeaways I hope you have from what I'm saying and what I've heard all day. Number 1, questions. Ask at each care transition, and there may be many, have a list of questions to ask members of your healthcare team. Number 2, healers. When treatment is over and the healing continues, other healthcare providers that separate from your treatment team may be best equipped to help with that healing. You've heard about a number of them today. And number 3 is take care. Take care of yourself. Take care of your health so you can live well beyond cancer. And with that, I intentionally spent a short time talking with the hope that you, the wisdom in this room, could add to what I had to say today. Thank you. So I think we have 5 minutes? So this is kind of the framework I set out, and I'd love to hear your thoughts, your questions, your words of wisdom. Oh, come on now, it's mid-afternoon. Should we do some arm exercises? I know many of you have, yes.
Okay, nice. So one of the things that worked for me was when you were asking the question, how can a person express their state of healing, was dividing that into the different components within my life. So as an example, home life, work life, etc.
Yeah.
Because part of it for me was, okay, and then decomposing that into further pieces. So as an example, what's my physical state, what's my mental state, etc. And then going further into that, so as an example, one of the side effects I had as a result of whether it was chemo, radiation, or just getting old, I'm not sure which, was a minor cognitive impairment related to short-term memory, which had a serious impact on work. So even though I didn't have cancer, I was actually in worse case for work than I was pre-cancer. So being able to understand that was absolutely critical for me to move forward to, whether it was long-term disability or Social Security disability insurance or any of those things that were changes in my work life, which were completely, to a certain extent separate from my home life, except for the financial ramifications involved around that. So, but being able to understand that was critical for me to be able to do something about it. So that was important for me.
So thank you for sharing that, and thank you for giving the whole life perspective, right? And about especially after treatment. So how did you come to understand that?
A lot of it was working with medical professionals. So as an example, I feel like I'm not remembering things, as an example. And then being able to talk to the relevant people in my care team, getting referrals from them, like to neuropsych as an example, and then working with them. And then there's some continuity between SLP in the neuropsych world and SLP in the oncology world, being able to leverage those connections, being able to understand what resources I had in my community and how I could utilize those effectively. But mostly it was about me asking questions and doing many of the things that you were describing, which I think are just great. So thanks.
So thank you for that. And I'm going to just kind of summarize what your process was, because I think this is one that sometimes comes up and is difficult to navigate. So where people sometimes after treatment feel like their executive function is limited and they're having short-term memory losses, and it's a way that they're like, I just can't function in my position, my high-level position the way I used to. And there are neurocognitive evaluations that are done to be able to really understand. It's helpful to understand then and get feedback on what the experience is, and that is actually what then is used to go through processes of either accommodation in a position or moving towards disability. So it's a pretty key part of the process. Thank you for sharing that. We have another comment or question over here.
Now I'm almost 8 years post-treatment, and I like to think of the cancer way in the rearview mirror. But still, if anything weird or unusual is happening in my mouth, the tendency is to go, oh God, it's right there over my shoulder. And it's a worry. And I don't want to try not to panic or anything, but it's there and it's a worry and it's a concern. Mm-hmm. And then, so I don't know, in relation to taking care of myself, that I guess that isn't exactly taking care of myself, but I'm wondering if you have any words of wisdom about that. But also another thing that's adjacent is if I have some other, because I'm aging and so forth, I have other unrelated medical struggles, and then I begin to feel sorry for myself. Haven't I been through enough? Now this? So anyway, the floor is yours.
Thank you. I would love to respond to that first part in particular, because thank you for bringing that up, because that is what happens when treatment is over, right? Go through treatment is like people like me in the past and others are saying, okay, if you have this, or this, call us. And then all of a sudden we become, these like new detectives to a body that we've carried around our whole lives. And then we say, well, treatment's over. See you in a couple months. And you're like, but wait, I'm still keeping track of everything. And like, what do I need to worry about? And for many people that have had a cancer diagnosis, they're like, well, it's anything I feel is cancer until someone tells me it's not. Right? And so we're thinking about it from the perspective of this experience. And so you are right on when you think in your mouth, like, gosh, I have this, if you're saying that you have a certain feeling, and you have to ask yourself the question of, could this be a cancer recurrence or not? Did I get that right? Yeah. And then who do you ask about it? Like, do you report it to the cancer treatment team? Do you report it to somebody else? And that's where sometimes there's a little bit of confusion. And honestly, often one of the deciding factors is how long it's been since treatment's over. And then as far as the other part about, the challenges that we're given, that often they're not fair. And the one response I have to that is about just us going back to what we can control, which is how we choose to think about things. And I think we heard so much about that today with hope and gratitude and how we think about how we're going to respond to this challenge in front of us, and then what we do next. All right. Well, thank you so much for your time and attention.